Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition thrombophlebitis or deep vein thrombosis in varicose veins. Okay, so by definition, thrombophlebitis or deep vein thrombosis is the inflammation of a superficial or deep vein that leads to the formation of a thrombus. Okay, so thrombus, guys, is a blood clot that forms in a blood vessel and remains in the blood vessels. Okay. Okay, note here, superficial or deep vein thrombosis is not a condition that can be treated with massage. The massage therapist's role is to report suspected DVT or deep vein thrombosis. Okay, so here you go, guys. The causes of DVT, one is venous stasis, which means coagulation or clotting. So clotting in the blood vessel, okay? Clotting of blood in the blood vessel. Okay, so there are contributing factors for this condition. One is age, two, prolonged immobilization, not moving the body or the joint or the parts of the body, cardiac failure, heart failure, or stroke and heart disease, trauma, any kind of trauma, anesthesia and surgery, using anesthesia and during a surgery or any kind of medical problem that uses anesthesia, and oral contraceptive use, so using contraceptives like pills to prevent getting pregnant, okay, can cause DVT as well, diabetes mellitus or mellitus. So these are some contributing factors that may cause thrombophlebitis or deep vein thrombosis. Symptoms. So deep vein thrombosis or DVT can happen in any vein, in the arm, most common in the legs. Signs of heat, swelling, and deep muscle pain, fever, and general malaise. Malaise, guys, means it is a feeling of weakness or overall discomfort or illness or simply not feeling well. Okay? Okay, medical detection and prevention. Okay, so there's Doppler test, which is to detect deep vein thrombosis, the DVT. So a Doppler test is using sound waves which are bounced off the blood within a vein. So this is an ultrasound machine that can detect these changes and determine whether blood within a vein is flowing normally. Okay, guys, so absence of blood flow confirms the diagnosis of DVT or deep vein thrombosis. Okay, there's prevention by wearing special stockings to improve venous flow. Okay, elevation of the lower limbs, which will be your legs, up to 20 degrees as possible. So you can do this by using pillows, okay, to elevate your legs. Taking anticoagulants or clotting medications, blood clotting medications, such as heparin and Coumadin. These two are popular anticoagulants. Okay, so let's discuss the varicose veins. So for this condition or problem, varicose means this distended or dilated vein. Okay, dilated. Okay, that is the meaning of varicose. And varicose veins are abnormally large and bulging veins. So here you go, guys. It is caused by the impaired function of the venous valves. So on our legs, there are a lot of veins, And in the vein, within the vein, there are numerous valves that control the flow of the blood. Okay, so if there is impaired function of one of these or one or more of these valves, then you'll get varicose veins. So the vein becomes bulge or expanded, okay, distended. So causes: habits that impair circulation and increase venous pressure, such as prolonged sitting or standing in one position, sitting with the legs crossed, and a sedentary lifestyle, tight garters or girdles. Sedentary lifestyle, guys, is a type of lifestyle which involves little or no physical activity. So often, a person is sitting or lying down while engaged in an activity like reading, socializing with friends, watching television, playing video games, or using mobile phone or computer, okay, for much of the day. So no activity at all. No physical activity at all, okay? So next, there's an increased pressure on pelvic veins, heavy lifting, chronic constipation, or pregnancy. Okay, so increased pressure on your pelvic veins and heavy lifting, okay, is common for causing varicose veins. Secondary to impaired or blocked blood flow from deep vein thrombosis, congenital venous malformation from birth, there's heart failure, liver dysfunction, abdominal tumors. Okay, so these are some of the causes. Another is vitamin C deficiency, which can weaken the collagen structure of the veins. Okay, so our veins is composed of collagen as well. So to strengthen collagen of our veins and skin as well, so any parts of our body that uses collagen, vitamin C is a must, is important to take in order to strengthen collagen formation especially in the veins. Okay, so when you have vitamin C deficiency, then the vein is weakened. Okay, so that's when malfunction of the valves can occur. Okay, that causes varicose veins at the start, and then deep vein thrombosis when it's severe. Okay, the symptoms. So symptoms of varicose veins are similar to deep vein thrombosis. Okay, so while they can occur in any age, okay, here you go, guys. So varicose veins can occur in any age. They are most common in people between 40 and 50 years of age, affecting more women than men. Okay, so most common to people at the age between 40 and 50, and it can occur at any age as well. Okay, so there is a familial tendency to developing varicose veins, okay, pertaining to familial tendency. Okay, varicositis result in enlarged and bulging veins. Okay, varicositis, and they are often bluish and lumpy. The veins can become tortuous, that is twisting and knotted, tortuous. Okay, this is easily observed when superficial veins are affected. Okay, in some cases the affected veins are relatively asymptomatic, but in others, dull, achy pain is experienced. Swelling may be observed around the ankles. Okay? A feeling of heaviness and fatigue in the legs is reported. Walking may be difficult. There will be leg cramps, especially in the calf muscles. Okay, the muscles located on the back of our lower leg. Okay, often occur at night. Here you go, guys. The pigment of the skin over the leg may be variable, appearing to be a shiny bluish brown. Okay. So for the medical treatment of varicose veins, it may include injections into the affected veins of solutions such as tetradicyl sulfate, which is saline. This procedure is followed by compression to the area. The solutions act to close the affected vein by fusing its walls to blood, so blood cannot pass through. The body will then find an alternate route for the blood. Okay? In cases where extreme pain is experienced, surgery may be used to remove the dilated veins, the bulging veins. Okay? This surgery is followed by elevation of the legs. So you have to elevate the legs, active foot and ankle movements, and walking. Okay? Support bandages or stockings are worn for several weeks. Okay, these are the medical treatment for varicose veins. Okay, so regarding support stockings, so most popular to use is the compression stockings for to prevent varicose veins from getting severe. Okay, so or to prevent the legs, the lower limb from having varicose veins. So let's move on to part 2, which is our subjective component. So here we're gonna ask health history questions. So here are some of the health history questions that you could ask your client in determining if the client has possible deep vein thrombosis problem or thrombophlebitis or varicose veins. Okay, so you're gonna ask the client, has the condition been medically diagnosed? If the client has varicose veins, you're gonna ask the client this question. If yes, when was the varicose veins or deep vein thrombosis or thrombophlebitis? You're gonna ask the client, when was the DVT been diagnosed? Okay, is there any treatment given for your DVT, such as medications? Okay, you're gonna ask this client. If yes, are you compliant with your medications and treatment? It's very important to ask this question. Okay, when did you start taking your medications? Okay, guys, this is important as well. When was the last time you took your medications? Also important. Okay, do you have a history of recent surgery, accident, injury to the blood vessels like bruising, heart disease, or deep vein thrombosis? Okay, have you been immobilized for a long period of time, such as a recent plane trip for a long uninterrupted drive or a long uninterrupted drive? Okay, is the client pregnant or postpartum? Okay, you're gonna ask your client as well. Do you take oral contraceptives like pills to prevent being pregnant? This question is asked as well for women clients. What is the location of pain or cramping? Is it localized, local to the area being complained about? What aggravates the pain? So you're gonna ask the client, what increases the pain? Okay, is there such activity or anything that the client do that increases the pain? Okay, since you are diagnosed with DVT, okay, has massage therapy been approved by your physician? Okay, it's very important. Are you taking any anticoagulant medications? Okay, anti blood clotting, blood clot medications. Okay, is it okay with you if I get your consent to contact your family physician to get more information about your condition? It's very important to ask permission from the client. Okay, you have to ask this question. Is there a history of recent surgery, accident, injury to blood vessels for wheezing or the pain of the disease, DVT or PE? Okay, so let's move on to part 3, which will be our objective component. So we're gonna discuss first about thrombophlebitis or deep vein thrombosis. So another name for thrombophlebitis is deep vein thrombosis. Okay, so we're gonna do the assessment in this level. So we're gonna be observing. Observation may reveal signs of inflammations. Okay, so on your observation, so edema is present. You're gonna see swelling, edema or swelling will be present distal to a partial or complete obstruction, most likely observed in the distal legs. When you mean distal, is the lower part of the leg, okay, especially around the ankle. Leg pallor may be noted. When you mean pallor, it means unhealthy pale appearance. So the appearance of the area is pale, which is unhealthy appearance. Okay, so distal veins may be distended in the lower leg. So we discuss about distended, meaning bulging or it's expanded, okay, in the lower leg. All right, so for palpation, we're going to do palpation. With deep palpation, there can be local tenderness when a thrombus is present. So thrombus, we discussed about it a while ago, which is a blood clot, okay, present in the area. A diminished or absent dorsalis pedis pulse may be palpated. Dorsalis pedis is the dorsal artery of the foot, which carries oxygenated blood towards the foot. Okay, so special test to do, we're going to be testing, or testing may be positive with Ramirez test and Homan sign. Okay, you're gonna know this test if you can research regarding this test, Ramirez test and Homan sign. These are the special tests that are used or effective in finding out possible presence of a thrombophlebitis, deep vein thrombosis in a client. Okay, the therapist may keep in mind that only about half of those with DVT experience pain as a symptom. Okay, so just take note of this. Therefore, a negative result will not necessarily rule out the presence of thrombus. Okay, so you have to make sure you did the special test properly. And if you have doubt, you have to refer the client to his or her physician. Okay, so let's discuss about the contraindications or precautions in treating deep vein thrombosis and possible varicose veins. Okay, with a suspected DVT, local massage and massage to the affected limb are contraindicated. So you never massage a client with a suspected DVT local to the area. Okay, client is referred to the physician immediately. Okay, take note of this, guys. You refer the client to the physician immediately. With femoral fracture, both legs are contraindicated. If there's fracture in the femur bone, then both legs are contraindicated. Okay, the client is referred to a physician as well. Passive and active movements are contraindicated in the acute stage of deep vein thrombosis. Passive meaning the client, there's assistance of the client in moving the legs or the affected limbs. Okay, and active movements means that the clients are the one doing the movements on the client's limbs. Okay, affected limbs. So they are contraindicated in the acute stage. So meaning in the beginning and the first week or two of having deep vein thrombosis. Okay, so you can't do any movements of the limb as well. Okay, if DVT is suspected in a client already receiving treatment, okay, treatment is discontinued. Okay, take note of this, guys. The client is referred for immediate medical attention. As the condition resolves, massage treatment may resume with consent from the physician, but the affected limb is avoided. Okay, take note of this, guys. So if the client has been diagnosed with DVT, you never massage the affected leg. It should be avoided. Sorry. Treatment of DVT. So treatment of DVT with heparin and Coumadin. These are the most popular medications. These are anticoagulation medications, so anti-blood clot. Okay, will lead to risk of hemorrhage. A consultation to a physician is necessary to have a safe massage therapy. So when the client is taking any heparin or Coumadin, there will be a risk of hemorrhage. So you shouldn't just be massaging the client without consultation with his or her physician to have a safe massage therapy. Okay, appropriate modification should be discussed with clients. So you have to modify your treatment involving this problem. Avoiding the legs and the lower body. Okay, avoid the legs and the lower body. Use less aggressive techniques on the lower body to avoid bruising. Okay, the therapist must remain aware that once a person has a history of DVT or PE, PE is related to DVT, she is more susceptible to developing it again. Okay, take note of this, guys. Caution is advised regarding aggressiveness of the massage to the legs. The therapist must be vigilant for symptoms of DVT or PE recurrence. Okay, so take note of that. Extreme temperature contrast hydrotherapy should be avoided to the affected limb affected with the DVT. So contrast hydrotherapy, very extreme, is a contraindication. Heat is contraindicated distal, lower, on the lower part, and immediately proximal on the upper part to the DVT to avoid further congestion of the area. So you can never apply heat hydrotherapy or any heat for the treatment on the lower part where you suspect DVT and on the upper part of the affected area. Okay, so it's a contraindication because it's gonna further congest the area. Okay, the blood flow, blood flow when you have this problem is not good. It's being blocked. Okay, now let's discuss about varicose veins. So assessing the varicose veins or assessment. The symptoms associated with varicose veins are similar to thrombophlebitis. So you're gonna look into the assessment for thrombophlebitis or the DVT. It's similar. Therefore, a thorough assessment for the possibility of deep vein thrombosis is carried out, and referral to a physician is suggested for a diagnosis. Okay, so contraindications and precautions. Deep specific techniques are contraindicated over varicositis and on any local tissue that appears dystrophic. Okay, dystrophic meaning not, not functioning, not the area is unhealthy. Okay, if the varicositis are painful, insensitive to the touch, local massage may be contraindicated. Okay, we're talking about varicose veins. Okay, varicositis. So it's more of local massage may be contraindicated. Okay, massage is contraindicated over esophageal varicositis pertaining to the esophagus area. Okay, it's contraindicated. Local massage is contraindicated for 24 hours after the medical treatment of saline injections in the affected veins. After surgery, local massage is contraindicated until approved by the physician. So if you have a client who has undergone medical treatment for saline injections or on the affected vein or presence of varicositis or varicose veins, or after surgery within 24 hours, local massage is a no-no, okay, until approved by the client's physician. Okay, take note of that, guys. Massage to the affected legs is contraindicated if there is no previous diagnosis of varicositis or thrombophlebitis or the DVT, but the client presents with DVT symptoms. Okay, if you're sure that you're finding symptoms with DVT symptoms on your client, even though the client has no diagnosis for varicositis or thrombophlebitis, then you know that it is a contraindication to massage the client. Okay, it's a no-no. It's contraindicated for massage treatment. Let's move on to part 5, which is the treatment plan. So let's discuss first with varicose veins. So we have goals. The goals for the treatment is to reduce sympathetic nervous firing, which is your fight and flight response. Okay, your reflex response. To reduce pain or inflammation. Okay, treat compensatory structures, those structures that may be indirectly or directly involved, affected by the problem area. Increase local circulation, so you have to increase blood circulation on the affected area, local, okay, on the area that you are doing treatment. Okay, positioning, pillowing, and draping. The client is positioned with the legs elevated. So every time you see a client with varicositis or varicose veins, or maybe possibility of having DVT, if you're not so sure, if you see signs, then you should elevate the legs. Or if the client has been diagnosed with DVT and has a approval from the doctors to undergo massage treatment, then you should elevate the legs. Okay, if the client is in the prone position, which is on the client's tummy, facing down, that's the position. A few pillows are placed under the shin and foot. Okay, so if the client is on a position of facing down, and you have to put pillows, elevate from the shin, okay, the front of the leg, lower leg, and the foot. Okay, when the supine position, and on the supine position, which is on the back, lying on the back or face up position, is appropriate, several pillows are used to raise the legs above the heart. Okay, so you should elevate the legs as well, the lower leg, okay, and raise it above the heart so that the leg is above the heart. Okay, the level is above the heart. Now let's move on to techniques. Okay, when a client who has varicose veins is massaged, okay, the pressure of the techniques applied on the affected leg should be modified. So you have to modify your pressure. Okay, you have to lighten up your pressure. A lighter pressure is used as its purpose is promoting lymphatic and venous return. Lymphatic, the other liquid on the lymphatic, lymphatic vessels, okay, and venous return, blood flow in the veins, okay. The direction of the pressure is towards the core of the body, with care taken not to direct the pressure towards the feet. Okay, so pressure is towards the core of the body, the center of the body, not not to direct the pressure towards the feet. So it's towards the heart, towards the uppermost area of the body, not towards the feet. Lymphatic drainage techniques are generally beneficial. It's very light technique just to, promote lymphatic vessel, lymphatic liquid flow nicely on the lymphatic vessels. Okay, so it's a good technique to reduce swelling and to encourage more lymphatic fluid flow. Okay, and it is best to know this technique and it's beneficial for a client with this problem. Passive movement of the joint in the leg, including the hip, knee, and ankle, is interspersed throughout the massage. Okay, interspersed throughout the massage. Okay, so these are some of the techniques. So passive movement, meaning the therapist is the one moving the joints in the leg, okay, including the hip, knee, and ankle. So with the help of the therapist. Okay. Okay, let's move on to hydrotherapy. Okay, it must be clear that hydrotherapy can't treat or cure varicose veins. It can only help manage the symptoms. A common varicose vein hydrotherapy involves putting gentle pressure of water to help blood move through veins, as well as changing the water temperature from hot to cold quickly, which also improves blood circulation and takes pressure off of swollen veins. If this isn't working, you can also try cold water only. Cool temperatures, on the other hand, have a shrinking effect. Okay, it will be, on the other hand, have a shrinking effect. It will be easier for your vein valves to circulate blood properly, and any kind of swelling will be reduced. So it means here that cold water therapy is more beneficial in helping with this problem. Okay, it can circulate blood properly, and swelling can be reduced as well. Okay. Okay, let's move on to part 6, which is the self-care plan. So to improve venous support, stockings are worn to support the veins and prevent swelling. So to improve this, to reduce this problem, support stockings, most popular will be the stockings that supports the leg, okay, against varicose veins. So the compression stockings, okay. Clothing that is restrictive at the waist or leg should be avoided. Okay, so Take note of this, guys. Prolonged periods of standing or sitting and crossing the legs, heavy lifting are minimized or avoided. Crossing the legs, so avoid doing that. Okay. Care is taken not to scratch or injure the skin over varicositis, since they may cause ulceration and bleeding. Okay, you have to inform your client as well about this. Okay, so standing in a bathtub of cold water and walking on the spot, water treating can improve circulation. Standing in a bathtub of cold water. The legs are dried off thoroughly afterward and warm socks are put on. Okay, take note of this, guys. Foot and ankle exercises are encouraged as is daily activities such as walking. Okay, Berger's exercises described in the edema chapter are useful. Okay, so just research on the Berger's exercises for this, guys. Clients are encouraged to take regular breaks to sit and elevate the legs above the heart. Okay, breaks may be taken as often as 3 times a day for 10 minutes at a time. Okay, the end of the client's bed can be raised slightly to encourage venous drainage during sleep. Okay, or you can put more pillows to elevate the lower leg just above the heart, the level of the heart. Self-massage for the legs is recommended, using specific techniques to increase lymph and venous return, lymph liquid and blood on the veins. Okay, the key is to direct the pressure towards the heart. So slight massage, you're gonna teach your client to do slight massage on the area, and it's towards, the direction is towards the heart. Okay, let's move on to treatment frequency and expected outcomes. Okay, if your varicose veins need further treatment or they're causing complications, the type of treatment will depend on your general health, on the size, position, and severity of your veins. Okay, a vascular specialist, the doctor who specializes in veins, will be able to advise you about the most suitable form of treatment for you. Okay, so here you go, guys. This ends our video today, and I hope you like, share, comment, and subscribe this video. Thank you for watching, and you have a great day.